This lecture will cover the nematodes, which are also referred to as the roundworms, and these can infect the intestinal tract, tissue, and blood. So the nematodes are non-segmented. Of course, they are roundworms. They are elongated and they are cylindrical, so they are kind of like a round tube type shape. And so they have well-developed digestive tracts, and they have a well-developed reproductive system. And so the adult worm can actually have separate sexes, so they can be male and female. And then the eggs are usually found in the stool sample, and so that's part of how it is identified. And so the infective stages with each of these organisms can vary depending on the species. Ascaris lambrocoides is the most common of the large worms that causes infection. It is transmitted fecal-oral. The eggs are ingested and then they hatch in the duodenum, and then the adults will live in the small intestines, and then the roundworms will actually, they are able to migrate and actually infect the lungs. And so this organism can also cause low flow syndrome, which is characterized by a high eosinophil count. So a lot of times when a CBC is ran and a large amount of eosinophils is seen, they're usually associated with an allergic reaction, but it can also be associated with a parasitic type infection. And so with these organisms, you're looking for, of course, you can see the worm itself, and so you can see how it kind of has those curved ends, but you can also see the egg within the stool specimen. And so what you're looking for is you can have fertilized and non-fertilized stages. So this one right here is an example of a fertilized stage. And with this, you get a very thick, rough outside cell wall. And so you can see where the cell wall kind of is real thick around the edges here. And then you've got all of this undeveloped embryo type cellular material here in the center, which is kind of globulous type material. The non-fertilized egg does look very similar. It's just usually more elongated out, but still with that wall that's thick, but not quite as thick. It's a little bit not as rough around those edges, but the composition makeup of it is very similar. And so this organism it can also cause vomiting and abdominal pain, can cause poor nutrition with the infected host, and although some patients can be asymptomatic, it can cause complications like intestinal obstruction, just where those worms start to get so large. And then, of course, like I said, it can migrate out through the lungs, can crawl up through to get to the lungs, the nose, so it can kind of go over wherever it wishes once it kind of gets to that adult stage. Enterobius vermiculus is also known as the pinworm. And of course, this is seen most often in children, especially school-age children, young children. And with this infection, the patient will actually ingest the egg, or they can inhale the egg, and then the egg will mature. And then once the adult female starts to reproduce and lay those eggs, the female will actually migrate out through the anal opening and lay the eggs in the perianal area. And so this can cause what they call itching or itchy butt syndrome in small children. Of course, small children would scratch that area, put their hands there. Those eggs would get on the hands, and of course from there it would continue to spread. And so this is where that Scotch tape prep method comes into play, where you use that Scotch tape to pick up those eggs and visualize those eggs under the microscope. So this worm itself, they're a little bit smaller, and when you collect those eggs, you're looking for something that looks kind of like a contact lens. So you can see that here at the bottom, or like a little football shaped egg looking thing. So they will look clear, but they look kind of like a little contact lens. Strongyloides stercoralis is also known as the threadworm. And the larvae can actually penetrate the skin, and then from there they can migrate to the heart and lungs. These worms do mature in the GI tract. So major clinical features that they present with is abdominal pain, diarrhea, eosinophilia. The patient could have like a allergic type reaction where the larval penetration has happened. And then with the migration, they can migrate to the lungs, and the patient can actually get a pneumonia type infection from these worms in the lungs. With intestinal, you have like abdominal pain, diarrhea, protein loss just from this organism feeding off the host. So these infections can be asymptomatic as well, but you can actually, with heavy infections, see these worms within the stool specimen. Immunocompromised patients could actually have an auto reinfection, and just where these organisms will kind of migrate throughout the body and spread within the patient can actually cause death within your immunocompromised patients. So with these organisms, what you're looking for in the actual worm itself is a short buccal cavity. So you can see here, like the mouth opening is very short and small. And then you've got very prominent genitalia. So you can see that larger genitalia there. I'm trying to find it here. Here's your genitalia on the wet prep organism. But you can see where this kind of buccal open is very small or short for this worm here. So most of these are usually going to be identified just based on the worm itself for the specimen. It could be recovered through different techniques, but usually it's going to be more of your automated techniques, PCR, that's going to help to identify this organism. Trichoris trichor. This is also known as the whipworm. So with this one, there is no tissue migration, so this organism does not kind of go through the body like the previous one. And of course you can ingest the egg itself, and then the larvae will mature in the intestines, and then the egg is passed through the feces. But the worm itself can burrow inside of the intestinal mucosa, and then those feed off of those secretions there. Patient can be asymptomatic, but it can present with ulcerative colitis, of course, from where it is kind of burrowing into that intestinal wall. And then what you're actually looking for, if the patient is presenting with symptoms like that, weight loss, bloody diarrhea, mucoid diarrhea, just from where it's buried into that cell wall, then what you're looking for with the malnutrition and stuff, things that's going to flag is you're looking for these eggs within that specimen. And so with those eggs, you are looking for these polar ends right here. So it's like little plugs on each end. And so as this organism matures, it can actually pop out of those plugs. And sometimes you can kind of see it coiled up inside of here, but it's a little harder to see. But it's usually brown, barrel-shaped type organism. And then so if you see those little ends like that, then it's kind of characteristic of it. And of course this is just an image of the worm, and you can see it kind of looks like a whip where you've got that long stringy like tail there. So we have two organisms that we're going to talk about for hookworms, the Ancylostum duodenum and Nematodes americanus. And so with these organisms, they will penetrate the skin, and then from there they can migrate to the lungs, and they're just kind of re-swallowed. The hookworms will attach to the GI tract and within the mucosa, and then they will start to actually ingest the blood. Then the eggs are passed through the feces, and then it kind of recirculates from there. And so these organisms do have a long buccal cavity. So you can see down here at the bottom where that opening of that mouth, so to speak, is a little bit longer. It's deeper in there. And then with this one, you have a smaller genital area here. So they do look very similar between the two. So it's kind of hard to differentiate one for the other, so it would just be treated as a hookworm type infection as far as if this organism was found. So, but the eggs do look very similar. So you have this kind of thick wall of this egg, and then you have all of these kind of like clumpy looking features inside the egg itself. And so that's kind of how it's going to be diagnosed, as based off the appearance of this egg within the stool specimen. With your tissue nematodes, they do have various stages. You have male and female adult stages, and then you have larval stages. They're transmitted through the arthropods, and then you can also get it through ingestion of a small freshwater crustacean or through contaminated meat. An example of this is the Trichinella spiralis. This makes like a little encysted larvae that will get inside of the host, so some type of like meat, poultry, or something like that. And then from there, it gets into like the inside of that muscle. So when that meat is consumed from something that's undercooked and it doesn't kill that organism, then from there that cyst stage is digested, and then the parasite will mature within the host and start penetrating the mucosa, and then from there they'll reach the bloodstream, and then they'll go into the muscle and get inside the striated muscle of the host. So the adult stage will reside inside the intestine, but it can also move throughout the system. The larvae can affect the brain or the heart tissue, and so diagnosis is made from a biopsy or muscle biopsy, in which the organism is surgically removed, and then you're looking at it under the microscope, and you're looking for that kind of spiraled up organism that you see in here in these images within that muscle tissue. We also have some hookworms that affect the dogs and cats, or ancylostrum. And so these organisms can cause CLM, which is characteristic of these little visible tracks in the skin. So you can actually see here in the pad of this foot where you can actually see the organism up under the skin there. And so these organisms are more common in southeastern United States, in which the larvae will actually penetrate into the skin, and then they'll migrate to the subcutaneous tissue and form those little tracks there that you can actually visualize. Filarial nematodes, these are transmitted by blood-sucking arthropods, and the larval stage will reside inside the vector, and then that can be transmitted to the patient. And so the adult worm is actually pathogenic to humans, and then once it gets into the blood, then it can actually migrate through to the connective tissue. And so with these organisms, they're diagnosed based on their presentation of how they appear and you're looking at like the tail of this organism to see where the nucleoli are within this tail. And so that's what helps to characterize them, but they kind of look very similar microscopically, so it's a little harder to differentiate them, but this is how they are differentiated. Here's an illustration of comparison of these organisms. We're only going to focus on two of them that are more commonly seen or something that you may be more familiar with. But again, you're looking for the different appearance of this organism here in this tail, how it presents in this area. Wuchereria bancrofti is transmitted by a mosquito bite. And so humans are the definitive host of this organism. And so you may be familiar with it with Echolin elephantitis, where it causes an obstruction of the lymphatic vessels in the extremities. And so here are a couple images of those where that infection has caused problems within that lymphatic system, and you get those grossly enlarged legs and things, or different extremities. And it can also cause hydrocele, where the scrotum gets really large. It can also infect the urine. And when I talk about the hydrocele with it affecting the scrotum, you can look up images of that. It causes a very, very large, grotesque look to that. So if you're interested, you can look that up. And then diagnosis can be made with looking at the parasite within the different fluids or through PCR testing.
Wuchereria bancrofti.
Loa loa is an eyeworm, and it is transmitted through the deer fly. And so these organisms will actually circulate in the bloodstream, and then they'll start to reside in the subconjunctiva. And so you can actually have symptoms of like cerebral swelling. And of course, finding this worm is going to be kind of characteristic of it. So you can find it in the tissue, eye, peripheral blood smear. And of course, you're trying to differentiate it based on those nucleoli. And so here's just an image where you can actually see that organism inside of that eye.